Chronic pain affects tens of millions of Americans every day, and although there are many strategies to address chronic pain, far and away the most commonly used approach is to write a prescription for opioid analgesics. The United States is in the throes of an opioid overdose epidemic, with more people dying in 2016 than at the height of the AIDS crisis. In a significant way, these numbers are driven by physicians overprescribing and inappropriately prescribing these pain medications. In 2016, the CDC released evidence-based guidelines for prescribing opioids for chronic pain. The goal of the guidelines is to ensure patients have access to safer, more effective chronic pain treatment while reducing the number of people who misuse, abuse, become addicted, or overdose from these drugs. A prominent focus of the guideline is on the communication of risks versus benefits and shared decision-making between physicians and their patients. This video is a dramatization of the CDC process. We hope you find it informative and helpful for you and your patient's health.
It's good to see you again, Paul. How are things going?
About the same, Dr. Jordan. The pain's still the same as it was. But the only good thing that's happened in the last 2 weeks is I was able to attend my niece's wedding. It was a wonderful ceremony.
Well, I'm glad to hear that you were at least able to go to the ceremony, but I'm so sorry you're still having the pain. Tell me a little bit more about the pain.
Yeah, it's just unbearable. I'm not able to sleep at night. I'm lucky if I get 1, maybe 2 hours of sleep. I can't focus or concentrate at work. It's just really, been a bad ordeal.
Paul, that sounds horrible. It must really be tough.
Yeah, and it's just unrelenting. But I wanted to mention that when I was at the wedding, I was speaking to a cousin of mine, and he had mentioned that he's taking Oxycontin, I think it's pronounced, and he said it helps him with his pain levels. So I was hoping perhaps it's something we could discuss today.
Thanks, Paul, for kind of letting me know what you're thinking about. Oxycontin is a type of opioid medication, and really that's not a type of medication that I would use for ongoing chronic pain like the one you're having now. The evidence is really mixed about its effectiveness because of the risks associated with the medicine. But in certain cases, if used appropriately, it actually can help, and we can talk a little bit more about that.
Yeah, I would like to. I really would like to do something to get my life back in order.
Okay, so let's talk more.
Okay, great.
Paul, it's important for us to be able to set clear, realistic goals. One of the things that you should know, it's really hard to really become pain-free. So what would you deem successful in terms of your pain level and your quality of functioning in your life?
Ideally I would like to be able to get a good night's sleep, maybe 6 or 7 hours would be great. And then secondly, if I could just get back to focusing at my job at work, that would, really be good. If I could get the pain level to a more manageable scale, that would be ideal.
Okay. Those actually seem like very kind of clear, realistic goals that we can work towards.
Oh, great.
We've already tried a few things so far, including some medications and some behavioral therapies that we talked about. Have any of those been helpful for you?
Not so much. I tried taking the medicine that you prescribed me a while back, and it hasn't helped too much with the pain, maybe just a little bit. So.
Gotcha. And I know that we had talked about some other behavioral activities and some other options. Were you able to do any of those things?
Yeah, actually I was able to start exercising. I go like every other day. It hasn't really done much to help the pain. And I also tried the heating pad, which I use at night, before I go to bed, trying to loosen up my muscles, but I haven't really had much success with that.
Okay, I'm so sorry to hear that. So it seems like we definitely need to talk about some other options.
Yes, I would appreciate that.
As part of the process for starting opioid therapy, it's very important that we cover really the risks and benefits associated with this medication.
Okay.
Okay, so one of the things that we want to talk about is for patients that take this medication on a long-term basis, you can actually develop what's called physical dependence, and in certain cases, this can go on to have people develop an addiction, even if they've never had a problem with drugs or alcohol in the past.
Okay, sounds serious.
Yeah, it is serious, and that's why we really want to monitor these risks associated with the medication. Some other things that I really want to talk about is that if you do take the medication for in higher doses or not as prescribed, there is a risk of death.
You mean like I could actually die from taking this medicine?
You can, so it's vital for you to take the medication as prescribed and to follow up on a regular basis. Some of the more common side effects that we worry about are nausea and drowsiness and constipation, but again, we'll monitor that as you come in.
Okay, so I think I have a pretty good understanding of the risks. What are some of the benefits that you were speaking of?
Right, so the benefit really would be that we want to decrease your level of pain, right, while also increasing your activity and your overall quality of life and functioning. And we really want to get to a point where the benefits far outweigh the risks when taking this medication.
Okay, well, it sounds intriguing. I mean, it's something I would like to look into.
Sounds good, so we'll talk more about it.
Okay.
If it's okay, Paul, I would like to ask you a few questions in your medical history.
Oh, of course.
Okay. Have you ever had any liver or kidney problems?
Not that I know of, no.
Okay. What about any mental health conditions?
Well, Dr. Jordan, I was diagnosed with depression many years ago, and I was on Prozac for about a year, but I haven't had to go back on the medicine since.
Yeah, I remember you telling me about that. I'm glad that you're not dealing with the depression anymore.
Yeah, that's really great.
Yeah. What about any sleep problems, like disruptions in your sleep, or has anybody complained about you snoring?
I mean, I don't sleep much. You know, as I mentioned earlier, I'm lucky if I get 2 hours of sleep at night. And what little sleep I get, my wife's never mentioned that I snore.
Okay. Paul, now it's really important for me to ask you some personal but really important questions that I ask of everyone. All right. Have you ever had problems with drugs or alcohol in the past, or are you dealing with any problems now?
I don't have any problems now, and I'm not sure I would describe it as a problem, but when I was in college, you know, on the weekends, everybody partied, and we drank a lot of alcohol, and I remember, you know, probably passing out maybe 2 or 3 times.
Okay. What about now, Paul? Do you drink any alcohol now?
Yeah, I have, you know, beer every now and then.
Okay. So, how much would you say in a week or a month are you drinking beer?
Probably not even a week. Probably a couple times a month I might have 2 or 3 beers, you know, if we go out to dinner or if we have to go to a function like a wedding or something like that.
Okay, so it's not a problem for you.
I don't think so, no.
Okay. And what about drugs? Have you had any problems with drugs in the past, or do you use any drugs now?
I don't use drugs now. Again, I don't think I had a problem when I was in college. I experimented with weed, you know, maybe 2 or 3 times. I really didn't, you know, care for it that much, so I stopped doing it.
Gotcha. Okay, Paul, thanks for being open and honest with me about those things.
You're welcome.
Paul, we should talk about how we're going to keep track of if the pain medication is working for you.
Okay.
All right, so every time you come in, I'll be asking about the level of the pain, but also your functioning and if it's improving your overall quality of life. And if we think the pain medication is working, then we'll continue the medication. But if we think like it's not really having an impact on your pain or your overall functioning, then we might need to take another approach.
Okay, right. Like you said, it's a trade-off between the risks and the benefits of the medicine.
Exactly, Paul. And so another thing that I'll be checking is those side effects, those common side effects that we talked about, like the nausea and the constipation and the drowsiness, because if you're experiencing more side effects, then again, we might need to take a totally different approach.
Okay, that makes sense to me.
Yeah. So, like we've already discussed, this pain medication has a risk of addiction. All right, so it's really important that you're open and honest with me about how effective the pain medication is and if you actually think it's being helpful. All right, one of the things that's kind of an early warning sign with addiction is to make sure that you're taking the pain medication as prescribed. And some signs that we look for is maybe the medication is running out earlier than it's supposed to, maybe you're taking higher doses of the medication than you're supposed to, or that you're just not taking the medication as prescribed. So these are things that you have to be really open and honest with me about.
Okay, that makes sense, sure.
Okay. Another thing that we'll be doing is monitoring your urine just to be sure that you're taking the medication as prescribed.
Whoa, I'm not so sure I like the idea about you testing my urine for drugs.
Yeah. So again, we do this also because of the risk of addiction, but also just to be sure that you're taking the medication as prescribed and that it's in your system.
I don't know, doctor. I mean, it sounds like you're saying I'm an addict and I haven't even started taking the medicine.
Yeah, Paul, again, I do not think you're an addict. I'm not calling you an addict at all. And these are tests that we do for all of our patients that are on this type of medication, just to make sure that they're safe and just to make sure that the system is working in the same way.
All right. I mean, I'm not too keen on the idea, but if that's what we have to do, I guess I'm willing to do it.
Yeah. No, again, Paul, I can totally understand why you wouldn't be happy about this, but I just want you to know it has nothing to do with you personally. It's what we do for everyone that's on this medication to make sure that you're staying safe and that the system is working in the best way.
Okay. I guess I'll go for it.
Okay. So, Paul, let's talk about your pain in a quantifiable way so that we can measure our progress. Does that sound reasonable?
Yeah, I think so. I mean, that way we can evaluate whether the risks and the benefits are worth it.
Exactly. So if we use a scale from 0 to 10, in the past week, how would you rate your pain?
In the past week, I'd say anywhere between a 7 and a 9, let's say 8.
Wow, so it's really, really high.
Yeah, like I said, it's unbearable. It never goes away.
Okay. Using that same scale, Paul, 0 to 10, in the past week, how would you say that your pain has interfered with your general activities?
Well, like we talked about earlier, doctor, I haven't been able to sleep much at night, so it's just, I can't get any rest. I just feel like a zombie.
Yeah. So if you had to really give me a number, what would that number be?
I guess I'd say an 8 too.
Wow, still pretty high.
Yeah.
Yeah. And again, using that same scale, 0 to 10, in the past week, how much would you say that the pain has actually interfered with your overall life enjoyment?
I guess I would rate that a 7. It's enough to make life unlivable.
Yeah. So from what I hear you saying, Paul, that it's about a 7.5 or 8, really, of how this is all affecting you.
Yep, that's pretty much it.
Okay. So if you, again, had to set a clear kind of realistic goal using that scale of what you would want to get to, what would that be for you?
I mean, ideally, I would like to get it down to a 4, maybe a 5. I think at that point, realizing what you said earlier, that we might not be able to get rid of it altogether, I could I can manage my life pretty well there.
Okay, so that seems like a clear, realistic goal that we could work towards, Paul.
Yeah, I think so.
Okay, great. So like we discussed, Paul, it's important for me to see you regularly on this new medication. So I'd like to see you within the next month. Is there any time that works for you?
I could do that. What do you say 2 weeks from now?
Perfect. Okay, Paul, so I'm going to write a prescription for an opioid medication. It's not going to be the long-acting Oxycontin that your cousin mentioned at the ceremony, but it is going to be a low-dose, short-acting opioid medication. You're going to take the med twice a day, once in the morning, and then once again in the evening. And then I'll have you back in 2 weeks so that we can assess how you're doing. Does that seem reasonable?
Yeah, that sounds pretty simple.
Okay. Is there anything that we haven't discussed that you wanted to talk about?
Nope, I think we've covered everything.
Okay. Then I'll see you in 2 weeks.
Okay.
Great. It's good to see you again, Paul.
You too, Dr. Jordan.
Thanks. So it's been about 2 weeks since we started you on the new pain medication.
That's right.
Good. So this is a good time to really review what we talked about at the initial visit and see how the medication's working for you.
Okay.
Great. So Paul, how have things been?
I'm not so sure. I mean, the pain has improved, but some of the side effects of the medicine are bothering me.
Tell me a little bit more. What do you mean?
Well, as you recall, when we were first met, you had mentioned that I might feel constipated or have some nausea. Actually, I've had both, and you know, it makes life a little bit more difficult to live. And then, you know, probably equally as troublesome is I just don't feel normal. I feel out of it.
Oh, goodness. That's not good.
No, you know, I was hoping things would be different.
Yeah. So using that pain scale that we talked about on our initial visit, how's the pain been for you in the past week?
The pain actually has improved. I would rate it a 5. It's just those other symptoms are troublesome.
Okay. So the pain has gotten better. It's a 5 now.
Yeah.
But using that same scale in the past week, how has your pain really interfered with your overall general activities?
Not so much the pain. Again, it's mostly the side effects, you know. I would say I would rate it as a 7.
Gotcha. Okay. And then again, using that same scale, in the past week, how has the pain really interfered with your overall enjoyment of life?
I would rate that as a 7 as well.
Okay, so still pretty much up there.
Yeah, you know, again, the pain is a little bit better, but the nausea and the constipation and the feeling out of sorts is
Yeah. So what I'm hearing from you, Paul, is even though the pain has improved, that those side effects are really interfering with your overall general activities and your overall enjoyment of life.
Exactly.
Okay, we might need to think about some different approaches.
Okay.
So Paul, let's go over some of the things that we discussed before that we need to keep an eye on.
Okay.
All right? So I just want to make sure that you're taking the medication as prescribed, that you're not taking higher doses of the medication or taking the doses more often than not.
Okay. I mean, actually, I haven't been taking as much of the medicine as you told me to. You know, mostly because of the side effects. I actually have some medicine left over.
Oh, wow. Okay. Did you happen to bring your medication with you?
I did. Yep.
Okay. Can I see it?
Sure.
Okay. So from what I'm seeing with your medication bottle and also the state monitoring database as well as your urine studies, everything looks pretty normal.
Oh, good. I'm glad to hear that. You know, I really just can't get over the idea of taking the urine test, and you know, it just feels like I'm being accused of something.
Yeah, I hear you, Paul. But again, I just want to reiterate that it's nothing against you personally. We're not accusing you of anything. It's something that we do with all patients on this type of medication, and we just need to make sure we're doing everything to keep you safe and minimizing those risks to keep you healthy. So Paul, have you kept up with the regular exercises and the relaxation techniques that we talked about?
Yes, actually, I'm still exercising, and I've taken up yoga, which helps my muscles relax. Hasn't really done much for the pain, but it helps me cope.
Well, that's great to hear. Some of those relaxation techniques can really be helpful.
Yeah, it doesn't help much with the pain, but it's definitely made me better able to cope and live a better life.
Gotcha. Well, again, one of the things that we really want to focus on is just your overall quality of life. You might not necessarily be pain-free, but I'm glad to hear that those other activities are actually helping with your overall quality of life. It seems like you haven't really been pleased with the medication overall.
Not really. It's helped with the pain. There's no doubting that. I just don't like the way it makes me feel. I don't like the fact that it's dangerous and perhaps addicting. I don't like all the follow-up tests and the urine tests and everything that goes along with it.
I hear you. And it really seems like from all the side effects that you're experiencing, it's really having a negative impact on your quality of life. So I really think at this point, the best decision is just to discontinue the medication altogether.
Yeah, I guess I would agree. It's just so frustrating to not be able to find something that works.
Yeah. Again, Paul, managing chronic pain can be extremely frustrating, but we'll keep working together to see what other options we can come across.
Okay. Well, thank you very much, Doctor.
That's great. It's important to calculate the morphine milligram equivalent, or MME, for any opioid therapy because it allows for a standardized scale of comparison. Studies have demonstrated that higher doses of opioids confer a higher level of risk to the patient for side effects, addiction, and overdose. Particularly be aware if you are prescribing over 50 MME per day. This is a good point at which to consider giving your patient naloxone to help protect against an overdose. Also, increasing the frequency of follow-ups with your patient can help reduce risk. Be very wary if you are considering prescribing 90 MME or more, and think about getting a pain specialist involved. These levels have been associated with increased morbidity and mortality. The CDC and other institutions have tools online available to help with calculating the MME for a given dose of opioids. For a patient on continuing opioid therapy, it's best to schedule regular follow-up meetings at least every 3 months. This allows for reassessment of the patient's status, including their symptoms, any side effects, and any warning signs for addiction or overdose. At these follow-up appointments, it's a good idea to go through the same steps and cover the same information because it gives you a systematic way to follow your patient's progress.
Thank you for watching this presentation of the CDC's guidelines for prescribing opioids for chronic pain. We hope it helps you provide quality care for your patients. More resources can be found at CDC's website, cdc.gov.